So we started early on in the pandemic, thinking about what can we do to pitch in and help in the fight against COVID-19. And at that time, we did not even know that long COVID existed. We just knew that the house is on fire. We needed to all pitch in to sort of help put the fire out.
Without even realizing how far the flames had spread, Dr. Ziyad Al-Aly became that first responder, jumping into long COVID research. He's the Chief of Research and Development at the Veterans Affairs St. Louis Healthcare System and a clinical epidemiologist at Washington University School of Medicine in St. Louis. Among his post-COVID concerns, heart conditions after COVID-19.
We started getting reports from a lot of patients that they're having heart problems, chest pain, arrhythmias, basically abnormal heart rhythm, et cetera, et cetera. So we decided to take a comprehensive look at the cardiovascular manifestations of SARS-CoV-2 infection.
So Dr. Al-Aly and his colleagues conducted an extensive study.
I went into this project thinking that we're going to find that people who had high risk factors for cardiovascular disease, people who smoked a lot, people who had high rates of obesity, people who had high cholesterol, or people who had family history of heart problems. I thought that these people, if they got COVID-19 is going to push them over the edge, manifest with high risk of cardiovascular problems.
The research began by diving into the vast de-identified database maintained by the U.S. Department of Veterans Affairs. It's the nation's largest integrated healthcare delivery system. The data set covered the months of March of 2020 through January 2021, involving more than 150,000 people with COVID-19.
Compared to control groups that are together more than 10 million people.
After the analysis of federal health data, what he found was not what he had expected.
What we found, it did not matter if you were young or old. It did not matter if you had prior history of cardiovascular disease. It did not matter if you smoked or not. It did not matter if you had obesity or not. All these groups, regardless whether they had high risk of cardiovascular disease or not, they still, whenever they got exposed to COVID-19, they still manifested with increased risk of cardiovascular problems. Really, nobody is really spared the adverse consequences of having COVID-19 infection.
He explains COVID-19 infection increases the risk of heart disease by nearly 5%.
With single-digit 5% of people with COVID-19 will get long COVID or have gotten long COVID. That translates to millions of people in the U.S. and many, many, many more around the world.
And that increased risk of developing cardiovascular complications happens within the first month to a year after infection.
Even if you're asymptomatic or have very, very, very mild symptoms, you're definitely not out of the woods. We see a lot of people who are asymptomatic. They didn't even know they had COVID-19. They did not even know they had it. They did not know they have it. And then, weeks later, they're like, this profound unexplained fatigue or brain fog or heart problems.
Such complications include disruptive heart rhythms, inflammation of the heart, blood clots, stroke, coronary artery disease, heart attack, heart failure, even death. Overall, those infected with COVID-19 were 55% more likely than those without COVID-19 to suffer a major adverse cardiovascular event, which includes heart attack, stroke, and death. The study does not include data involving Delta and Omicron variants.
So we don't really know if the newer ones, like Omicron, is associated with less risk of long COVID. Chances are that it might be.
Al-Aly is now tackling this as well.
We are looking at long-term consequences of having pre-Delta, Delta, and Omicron, and now actually BA.5.
In another study, Dr. Al-Aly helped prove vaccinations reduce the chances for long COVID by 15%, which helps, but he says long COVID is still a problem for the vaccinated. Besides the heart, long COVID conditions have a wide range of health problems.
It's not a small problem. It's not a trivial problem. It affects anywhere between 5 to 30% of the people who got COVID-19 in the first place. So it's a serious problem. It is real, and we need to definitely address it.